Hello and everyone. Today in this festive season of Durga Puja, Diwali, Navratri and all the festivals which is going to come up in the near few days, let us talk about a specific illness which we often see during these festivities. And what is that illness? Or precisely, what is that cardiac syndrome which can lead to multiple complications, which can lead to heart failure, which can lead to cardiac arrhythmias, and in the most unfortunate scenario, can lead to death also. And this syndrome mimics or actually is a masquerading feature for myocardial infarction or heart attack, and this is known as festive heart syndrome. So what is festive heart syndrome? We also call this as a holiday heart syndrome or a happy heart syndrome, and scientifically we have been taught to say this as a Takotsubo cardiomyopathy or a stress-induced cardiomyopathy. So in the next few minutes, I'm going to take you to this very interesting disease called a happy heart syndrome or a festive heart syndrome, which in the recent times we have come across in few population who have underwent a stress which could be either emotional or physical and which they are unaccustomed to. So I'll give an example of a 45-year-old lady. This lady stays in a nearby residential complex and she was about to offer her Durga Puja offerings one fine evening on the day of Ashtami, and after a day of joyfulness and offering festivities and puja, suddenly she fell ill. She felt a chest pain which was not there even a day back, and she was rushed to the emergency, and it was found that she is suffering from heart attack. So what has happened? Her ECG showed certain changes which are similar to those seen during a frank ST segment elevation myocardial infarction. That means, in all probability, this lady had some form of heart attack. And how do you know that this is not a heart attack but a form of festive heart syndrome? By doing a coronary angiography, we'll see that all her coronary arteries were normal in caliber. There were no obstruction or blocks anywhere in the coronary artery, but the cardiac pumping function had come down from a normal cardiac pumping function of 60 to 65% to a very dismal level of 25 to 30%, and a major portion of the heart was not pumping. It was as if the distal part of the heart, the apical portion of the heart, has ballooned out, and that is why we also call this syndrome as a apical ballooning syndrome. That means to say that the heart has ballooned out and it is looking like a pitcher. So in the Japanese, they have this squid traps or the octopus traps which looks like this, and the name Takotsubo comes from that only, where you have this vase which is being used to trap octopuses, and where you get this kind of heart which is called as Takotsubo cardiomyopathy or a stress cardiomyopathy. And this stress could be anything which is unaccustomed to. It could be excesses of joy, excess of fun and frolic, excess of sympathetic overactivity which he or she is not used to. And what happens when you suffer from this kind of heart attack? Your pumping function suddenly comes down, your heart rate goes up, you feel less energetic, and your ECG shows signs and symptoms of a typical heart attack, although your coronary arteries are normal. And most importantly, it has also been seen that festive heart syndrome or a holiday heart syndrome is not a benign condition. It has been seen that in a certain subgroup of patients, they actually have long-term consequences in the form of dilated cardiomyopathy. They have recurrence of these events, they have thrombotic complications, and very unfortunately some patients also die because of these complications during hospitalization or after discharge. And one of the most important factors is sudden unaccustomed consumption of alcohol. So in this festive season, if you are enjoying it, everyone, please be careful, please be sincere, and be responsible towards each other. Do not indulge in a bout of alcoholic binge. Do not overstress yourself in the form of physical or mental exertion, and maintain a sanity with which you are used to. And that is how you can prevent this festive attack or a holiday heart syndrome or a Takotsubo cardiomyopathy. So this small session is actually a very important session which is going to reinforce you the importance of maintaining a healthy habit and a lifestyle in spite of all the festivities and all the grandeur which is going on in the current times. So I hope in this video you have understood the consequences, and I hope that you are going to take proper care of yourself and all your family members to have a very happy and a prosperous festive season. Thank you.